We have the next iteration of an ongoing problem in that pharmacies are running low on Paxlovid as the summer COVID spike continues, where the issue is that many independent pharmacies across the state are not adequately stocked with Paxlovid. So for a little history into this issue, initially the federal government had struck a deal with Pfizer, the manufacturer of Paxlovid, to provide millions of packets of the treatment regimen to pharmacies, hospitals, and other medical providers. However, with the end of the public health emergency in 2023, the government also stopped covering the cost for Paxlovid. And also at the same time, Pfizer decided to ridiculously upcharge the medication, where the price is currently fluctuating between $1,400 and $1,500, where on average Paxlovid is priced at $1,400. For those on Medicare and Medicaid, they can still receive Paxlovid at no charge through the end of this year. Similarly, the PAXS program also ends at the end of this year as well, meaning for those uninsured and underinsured, Paxlovid will become unaffordable, unattainable, and inaccessible. Furthermore, while it should still be readily available now, that doesn't always mean that patients can find it within their local pharmacies. And as one pharmacy states, Paxlovid is simply too expensive for us to stock, but they will special order it for the next day. However, many insurance plans won't cover it, and if they do, the copay is so high that most of our patients can afford it, meaning that this is a two-pronged issue: the cost for the patients and then the cost for the providers, namely the pharmacies. Because while many insurance plans provide some coverage for Paxlovid, it's the upfront costs that are causing these supply issues. Pharmacies in Arkansas said that it takes weeks or months for insurance carriers to reimburse them for the medication, creating cash flow problems. Where even when patients are using the PAXS program, it can take up to 3 months for pharmacies to be reimbursed. Additionally, some insurance companies offer reimbursements that fall short of the wholesale price to the pharmacies themselves, meaning that pharmacies that provide lots of Paxlovid to their customers could incur significant losses, as they would have to cover the difference between what the medication costs and what the insurance covers. Where another pharmacy stated that they can only keep 2 packs in stock across all 6 of their pharmacies, because while the wholesaler has plenty of Paxlovid in stock, it's costing the pharmacies over $1,300 per treatment pack for a medication they might not be reimbursed for, or that they'll be providing for a loss. So it's really important to emphasize that this is not a stock issue. This is not a situation where there's so much demand that the manufacturer can't keep up with it. Paxlovid is sitting in these wholesalers, these warehouses essentially, but these pharmacies can't really tap into them, and the patients then can't get them because of the exorbitant cost of the medication. Which again means that patients should be able to find it, but it's not something you can just walk into any pharmacy and get. Which is why with COVID still ongoing, the pandemic still ongoing, the government should have never ended the public health emergency. Because when the government was covering it during the public health emergency, these independent pharmacies that are now struggling would at that time have 30 to 40 boxes available at all times. And now it's even difficult for pharmacies to keep even 1 or 2 packets of Paxlovid in its inventory because it costs so much upfront. Meaning that if pharmacies aren't reimbursed adequately for certain drugs like Paxlovid, they won't carry them, and then patients are harmed. Which means, as you've probably guessed by now, that this is a result of Phamacy Benefit Managers, because the pharmacies are paying $1,400 to buy the drugs, and then these Phamacy Benefit Managers are negotiating for an insurance reimbursement that is less than the price of the drugs. And in a capitalist society, if you're operating at a loss, you're not going to provide whatever that thing is, whether it be Paxlovid or something else, which is why many pharmacies are either choosing not to stock it at all or have very limited supplies of it in the first place. And there is stuff moving through the federal government that can finally address this issue, but this is a long ongoing problem and nothing has been finalized in the laws. Further compounding these issues are that places like the Arkansas Health Department aren't even acknowledging the issue itself, where the Arkansas Department of Health is saying that they're not aware of any Paxlovid shortages, which is a technicality because technically there is no shortage. There's plenty in stock in the warehouses. In essence, it's an artificial shortage created by a problematic system, meaning that many people are going to be hurt right now because they're not going to be able to access Paxlovid, despite the fact that we're in the largest summer wave of the entirety of the pandemic right now, and what's currently looking like the second highest wave of all time in our pandemic. Meaning that a lot of people are going to be looking for this and they're not going to be able to access it, which is a problem.